Yes, thank you. So this mysterious title, The Road to 2026, really refers to a body of work that is being done by a group of people from within the International Consortium for the EDS classification of the EDS Society. And so we will update the EDS classification and also develop some diagnostic pathways for Ehlers-Danlos syndrome. So, but first I would like to share with you some history on the Ehlers-Danlos syndromes and why, starting from a historical perspective, we think that it is necessary to develop this updated classification and diagnostic pathways. So here on this slide, you see one of the first people that were reported in medical literature. You see this in the 17th century. It was a young boy of Spanish descent and who had this remarkable elasticity and soft of the skin and a very soft skin. So you see it here, a soft-skinned Spaniard. And he was reported by a Dutch dermatologist, Job Janszoon van Meekeren. And it was those three people here who then presented some of the first patients that later came to be known as Ehlers-Danlos syndromes at medical conferences. So those were three dermatologists, and the first one, a Russian dermatologist, Chernogubov, presented two patients with a velvety, thin and hyperextensible skin, scar formation and extreme joint mobility with subluxations. And then a few years later, this French dermatologist and Danish dermatologist also presented some individuals who also had the same constellation of symptoms, so the combination of this hyperextensible skin and loose jointedness. And then this condition later became known as the Ehlers-Danlos syndrome. And then it was in the 1950s that Dr. Janssen, who was again a Dutch dermatologist, looked at the skin of some of the individuals who presented such a clinical presentation. And he was actually the first to suggest that this condition could be caused by a defect in the collagen wickerwork, as he then described it. And indeed, this was later confirmed by biochemical testing. So in the 1970s, people started to do biochemical testing on the skin of individuals with different presentations of Ehlers-Danlos syndrome, and indeed confirmed that this was due to an abnormal collagen formation. And also, by doing this and then also looking closely at the clinical phenotypes of these patients, it became clear that EDS was not one condition, but actually there were different variants or different types, each with their own clinical and biochemical pattern, let's say. So that's when also people started to then classify these conditions. And so, as you will see over the next couple of slides, we've had many different classifications for EDS over the years. And it was the idea to show the picture of Peter Byers, but somehow now you see me instead of Peter Byton, sorry, but you can't really see him very well. But Peter Byton actually made a huge contribution to these early classifications of Ehlers-Danlos syndrome, and he sadly, thank you, passed away last year in South Africa. But one of the most early classifications of EDS you can see here, that was done in 1968, and then 5 types of EDS were recognized, and you can see how they were called then. You had the gravis and the mitis type, hypermobile, the vascular, and an X-linked form. And then there have been updates on these classifications, and as you can see in 1988, there was a huge effort to classify all the heritable connective tissue disorders, and within that 11 types for EDS were recognized. You can see here. Then they were assigned with a Roman number, EDS 1, 2, 3, 4, etc. And then in 1997, a group of experts came together in a beautiful place called Villefranche-sur-Mer in France, and they revisited everything that was known at the time, both from a biochemical and microscopic point of view, but at that time also DNA sequencing had begun, and so the first mutations had been identified in patients with Ehlers-Danlos syndrome. And so that's where the Villefranche classification was born. And this classification withheld 6 types of EDS. And so for each of this type, a descriptive name was given. So that's where we started talking about classical hypermobility, vascular EDS, and then also kyphoscoliosis, arthrochalasis, and dermatosparaxis type of EDS. Over then the next couple of years, so especially as you can see here between 2010 and 2020, with the advances in the techniques for looking at our genetic material, more and more genes were being identified in people with distinct clinical presentations of EDS, and actually more and more types of EDS were indeed being identified. And so a group of experts, and that was then also when the EDS, the International EDS Consortium was born, really looked again at everything we knew at that time about EDS and updated the classification. And so then in this classification we recognized 13 subtypes, and so the descriptive names were kept, and for the new types, new names were invented, let's say. And so you can see here that there is a whole series of genes that are associated with all these types of EDS. And so that was 2017. But we are now already 7 years later, and so there are again gaps in this classifications, and there are new challenges, because since then, of course, our knowledge about EDS has really also expanded. And for instance, since the publication of this new classification, new variants of EDS have been reported. The first one was actually very rapidly after the publication of the 2017 classification. That was the AEBP1 gene that is now provisionally classified as a classical-like EDS type 2. And then more recently, there was a report on mutations in this gene, which codes for a protein thrombospondin 2, that also appears to give rise to a phenotype that is really an EDS phenotype. Another thing that we are faced with is that we really need a critical revision of which conditions belong within the EDS group and which conditions perhaps do not. Because at the time of the last update in 2017 of this classification, for some of these types, only a handful of patients had been identified, and we did not know too much, let's say, about the clinical presentation of some of these phenotypes. But now we know more, because more patients have been diagnosed and have been studied. And I'm just giving you an example. For instance, we have this type here, which we call the spondylodysplastic type of EDS, and this is caused by mutations in this gene here. And so you can appreciate that these people have a very severe phenotype with joint hyperlaxity, joint contractures, very severe kyphoscoliosis, but then you can also see that they have the very typical skin features that we see in EDS with the skin hyperextensibility, atrophic scarring, and so on. On the other hand, mutations in the same gene have also been identified in a condition with this very long name. We are very good at inventing very long and unpronounceable names. But this is actually not classified as an Ehlers-Danlos syndrome, but as a skeletal dysplasia. Yet the mutations, the variants are present in the same gene. And you can also appreciate that from a skeletal point of view, there is a lot of overlap between these two conditions. And so we really have to decide whether the natural home of this condition would be EDS or perhaps maybe more skeletal dysplasia. And so the same is true for a few other of these rare variants of Ehlers-Danlos syndrome. Then there are still patients who present with a phenotype, so clinical presentation of EDS, and here I'm not only talking about hypermobile EDS, but really very complex types of EDS, but in who we do not find a genetic defect in any of the known genes. So we do, presumably there are still novel genes to be identified for rare types of EDS, but at present, within this classification, we don't have a specific diagnosis for these patients, and so they are a bit left out. So that's also a problem for these patients. And then, of course, a very big challenging question is what is hypermobile EDS, what is the difference with hypermobility spectrum disorder, etc. So these are all challenges that we face when dealing with this classification. So one of the goals of this whole Road to 2026 exercise is to update the EDS classification. But before we do that, we've, as a group of experts, come to the conclusion that first we need a critical revision of the definition of EDS. So here you see the historical definition of EDS, which I don't even know, perhaps Peter Byers would know, but who actually first defined this. I think it's in the huge textbook by Beat Steinman that this definition, the historical definition that you read everywhere this is a clinically and genetically heterogeneous group for irritable connective tissue disorders, and the main characteristics are articular hypermobility, skin extensibility, and tissue fragility. But is this still true? Is this still enough, I would say? Or do we need other characteristics, other factors in this definition? For instance, does it have to be related to a collagen abnormality or not? Or do we take other symptoms into this definition? For instance, some of those comorbidities that we see, especially in hypermobile EDS, but perhaps also in other types of EDS. So we really need to find a consensus about the definition of EDS before we can decide which phenotypes, which clinical presentations we're going to accept into the EDS classification. So how are we going to do this? So we are going to use the Delphi or the Delphi method. That's based on the Delphi oracle in ancient Greece. So this is a structured technique to modulate a group communication process effectively in allowing a group of individuals as a whole to deal with a complex problem. So this Delphi method is a structured method of developing consensus among a panel of experts. And so this is what we're going to use to try to come up with a consensus on the definition for EDS. And so a survey on what is EDS has been developed now and will be distributed among an expert panel of members of the EDS consortium in order to gain a consensus on this definition. Once we agree on this specific definition, we can decide which of all these EDS or all these variants can go into the classification, and some of those maybe will leave the classification. And in order to do that, we need to do a critical review of the literature and on everything that has been published on all the different types of EDS and do a good summary. And then this will allow us to decide then which conditions remain in the EDS classification and which do not. And probably we'll also need another Delphi survey for this. So you may ask why is this so important, this classification? Well, it is important for many different reasons. It helps doctors and scientists to recognize disease patterns. It's important for epidemiological purposes. It's important for developing healthcare policies. And of course, it's also important for clinical use, such as diagnostic use, healthcare management, and it's important for research. Now, with regards to the diagnostic use, this is also a second aim of this whole work, is to develop diagnostic pathways for EDS. And this is to answer the question, how can we help the medical community and our patients to better recognize these disorders and improve timely and accurate diagnosis? Because as with many rare diseases, many patients who have EDS go through what we call the diagnostic odyssey, and sometimes it takes years and years before people actually get the right diagnosis, and we get misdiagnosis, we get delayed diagnosis, and so on, which has of course also many adverse effects, such as a large psychological impact. So this diagnostic pathway should help non-EDS experts, so healthcare professionals, in identifying likely cases of EDS for specialistic evaluation, and should increase the awareness of this disease and thus reduce delay in diagnosis and management. So, and the idea is that we produce a paper on the diagnostic pathways for EDS, but also design supporting material such as graphics and pictures and of skin abnormalities, etc., that help to recognize the signs of EDS, and perhaps also develop an easy-to-use app that people can actually use in their office to help in the diagnosis or identifying those individuals who need specialistic advice for the diagnosis of EDS. And so we will also, while doing this literature review, make expert papers on each rare type of EDS, because as we have seen today, we've heard a lot about vascular EDS, but for many of the other even rarer types of EDS, such as, for instance, the kyphoscoliotic or the dermatosparaxis or the arthrochalasia type of EDS, there is very little information out there. And so for people not familiar with these conditions, it's very difficult to find the correct information. So collecting all this information and then also together with expert opinion would really provide a huge body of information to the healthcare community. So the eventual goal is to provide accurate and educational material, increase awareness, provide guidelines for the diagnosis of EDS, and so increase access to timely and accurate diagnosis for patients with all types of EDS. And so this is the group of people who are very actively involved in this exercise. There are people from the UK, from the US, from Australia, so a very expert group of people. And and then also the international consortium of EDS is involved, and all of this could not be done without the help of the EDS Society, but also some of the European reference networks for where EDS is involved. So thank you very much for your attention.